So egg freezing is an incredible technology that we have really gotten better at over the past probably just 10 years even. But it's important to note that some people dub it an insurance policy, but I would be really wary of using that term. Women really sort of discover or start talking about this in their mid to late 30s, but it's really important to note that your eggs are sort of their best quality probably in like the late 20s, 30 to 32 age range. And that's really when, if you want to freeze your eggs, you should start thinking about the process and getting on top of it then, instead of waiting till maybe 39, 40, 41, because you want to make sure you have the healthiest quality eggs possible when going through the egg freezing process. When it comes to the financial burden of egg freezing, there are a couple things you want to consider. The first thing you should do as a consumer is call your insurance policy and see if you have any fertility or egg freezing coverage. And that can be for the in-office procedure itself. It can be for all the ultrasound and blood work appointments. And some women may even find that they have insurance coverage for medication. So those are all things that you may end up, if you don't have insurance coverage for, paying for out of pocket. So again, the actual egg retrieval itself, the in-office ultrasounds and blood work, and then the IVF injectable medications, which can be really expensive if they're not covered. So that's one component. And then once the eggs are removed, you have to pay sort of a cryo and storage fee, so a freezing fee, and then you obviously have to pay a storage fee for every year or a month, depending on the plan you work out with the facility that your eggs are frozen. So those are things to take into account when you're looking into budgeting for egg freezing.